based upon the results of the APT study, and there was a recent update, 7-year results that was published in JCO this past year. So in patients with small HER2 positive breast cancer, stage 1, maybe screen detected disease, most of those patients were excluded from the large adjuvant trials with trastuzumab. So this was a single arm study that looked at these patients getting weekly paclitaxel and trastuzumab for 12 cycles, followed by adjuvant maintenance trastuzumab. And the 7-year disease-free and overall survival in this trial is excellent, in the range of 93 to 95%. And so in those favorable patients, we can think about sparing them the more aggressive chemotherapy with anthracyclines, for example, which can increase cardiotoxicity in these HER2 positive patients. The ATTEMPT trial that was presented at San Antonio last month as well was also targeting this favorable risk patient population and looking at TDM1 for a year in place of the weekly trastuzumab paclitaxel. And again, showed excellent short-term follow-up. 3-year disease-free survival was over 99%, but the toxicities were different. So there was more acute neuropathy with the paclitaxel, but other side effects with long-term TDM1 included LFT abnormalities, thrombocytopenia, and that led to more early discontinuation of TDM1. So I don't think it's quite ready for prime time for those more favorable breast cancer patients, because the follow-up was still very short, and the short-term follow-up, the higher discontinuation rate, not to mention the additional cost of the TDM1. But I do think that there is a role for looking at non-chemotherapy options in this favorable risk population.